Hi guys, welcome to the JCTC Pharmacy Tech Classroom and Lab. I'm going to do a little bit of an orientation for you here so that you kind of get the layout. I want to start with this wall because this is the coolest wall in the entire college. These are our students of the year for the past several years. Every one of these students had good academics, but more importantly, they were leaders in their classes. Some of them have come back and joined me as a lab assistant. That would be Philip. And JJ here actually was our first student to become a pharmacist. So we've got lots of great success stories, and I can't wait for you to be our next one. So we'll just walk around the room. You'll have to forgive us. It's a little bit messy because the students just finished labs right at the end of this COVID. I have a separate video for our retail lab, but we also have over-the-counter medications here. So over-the-counter medications are the ones you don't need a prescription for. Those continue over here. We have some in the storage space on the wall. These are blister packs that we use in long-term care. So we'll repackage some of these, keep those here. This may be the most important part of the entire lab. This is the coffee pot, along with the printer. This we use when we get to IVs, so we don't have to worry about that just yet. These medications are oral syringes, so syringes without needles. And this is one of the labs we'll do. We'll actually measure out some of these medications. Eye wash station. We only have a few actual chemicals in the lab, and probably the worst one to get in your eyes is menthol. So we'll be very careful with that. But sink, we have some of our tools that, beakers and graduated cylinders that we'll use. Make sure you clean up after yourself because your mama doesn't live here. These are our flow hoods. We'll work with these when we start with IVs. Pharmacy technicians do make the IVs that the nurse ends up giving to the patient. That's a very important part of what we do, and that requires very specific training. Over here we have some unit doses. So in a hospital setting, medication comes to the patient in individual doses, not in a bottle. So we'll repackage these. We'll make sure that we know how to do that. On the back side of this is medications that come in injectable form. So for the most part, we won't use these till the next semester when we work on the IVs. Over here is our glove box. So this is used for making hazardous medications that we want to be protected from. We have gloves. We have some other things kind of scattered around. Hopefully have this a little bit better organized for you. If you're wondering why there's a hairdryer, well, medications come with the shrink wrap to show that they're tamper proof. That helps us with that. We have several computers around the lab, and you're welcome to use these. And if you need to print something, it will print on the printer I just showed you. Here's some of our compounding supplies. We have the mortar and pestle. We have beakers, scales. This is an ointment slab to mix up ointments. This is hazardous drugs. We will be making our own capsules. They're nice and pretty. These are still set up for the IV processing. It's basically the same thing as the flow hoods that I showed you. These are just practice, whereas the other two are real. So this will be up for the second semester students. Here we have some various different things to put medications in. So some medications might need an eyedropper. These are for foot powders. We have nasal sprays. So various different containers that we would need for medications that weren't pills. We have lip balm tubes, and so on. Some more capsules. And here's some of the compounding labs that we just finished. So we have our ingredients, ointments lab. We do have another counting tray. This is called a mortar card. So if you've got powder stuck in there, it can help you scrape it out. Here's the drugs that we would put in those compounds. And, you know, we'll do more orientation and cover more of the specific ingredients and tools used in compounding when we get to that point. We also have trays. This one's kind of in the wrong place. But in the hospital, trays are... There's different types. This one is surgery tray, so the drugs would be for surgical purposes. We also have a pediatric one and an OB one. So our job would be to find the medications and fill this tray perfectly. This machine processes the pills into unit doses like we saw over there. Again, we have some additional computers for you to use. This is called a med dispense. In the hospital, it's called a Pyxis or Omnicell. There's different names for the technology, but basically the computer screen is here. The nurse puts in the order and it'll pop open and the medication will be there. It'll be there because we put it in there. So we have to work with this technology in the hospital all the time. Another old technology is called a cart fill, where the patient's individual medications will be in a drawer with their name. So we'll do a lab with this. And along with this lab, we have another small safe out here for controlled drugs. So this is just specifically for the drugs that are in this particular lab. And now we've come full circle, and we do have a few little lockers if you think you need them. But we've come back around to where we started, which is with the best students in the world. Thanks.